Welcome to the step-by-step handling guide for the reconstitution and installation of Hexvix. For reconstitution and installation, you will require one Hexvix pack. This contains a vial of 85 mg of hexaminolevulinate, which is a white to off-white or yellow powder, and a pre-filled Luer-Lock syringe containing 50 ml of clear, colourless liquid to dissolve the powder. You will also need a large gauge needle, a Luer-Lock catheter adapter, at least one pair of sterile gloves, a disposable straight or intermittent urethral catheter with a proximal funnel opening, an anesthetic antiseptic lubricant, and a sterile catheterization pack. Wear clean gloves for the preparation, and the sterile gloves from the catheterization pack later on for the catheterization. Fasten the plunger rod into the rubber stopper of the syringe by turning the plunger rod clockwise until it stops. Remove the blue cap from the powder vial. Remove the cap from the syringe and keep it for later use. Connect a needle suitable for reconstitution to the syringe. Hold the syringe upright and carefully press the plunger rod upward to remove air. Inject about 10 ml of the solvent from the syringe into the vial of Hexvix powder. The vial should be about 3/4 full. Without withdrawing the needle from the vial, hold the powder vial and the syringe in a firm grip and shake gently to ensure complete dissolution. Turn the vial and syringe upside down and withdraw all of the dissolved solution from the powder vial into the syringe. Disconnect the empty vial from the syringe. Disconnect the needle from the syringe tip and discard it. Plug the syringe with the syringe cap. Gently mix the contents of the syringe. Hexvix is now reconstituted and ready for use. The appearance of the reconstituted solution is clear to slightly opalescent and colourless to pale yellow. Add 2 hours to the time of reconstitution to determine the expiration time. Write the expiration date and time on the syringe label. The patient should be catheterized and the bladder completely emptied prior to the installation of Hexvix. After catheterization, connect the Luer-Lock syringe containing Hexvix to the catheter using the Luer-Lock catheter adapter and gently instill the entire 50 ml volume of Hexvix into the bladder. The patient should retain the 50 ml of Hexvix solution for approximately 60 minutes. After voiding the bladder of Hexvix, routinely wash the patient's perineal skin region with soap and water and dry. If the patient has not retained Hexvix in the bladder for 1 full hour, still allow 1 hour to pass from the installation of Hexvix into the bladder before starting the cystoscopic examination. Following evacuation of the bladder, the blue light cystoscopy with Hexvix should start between 1 and 3 hours after installation of Hexvix.